Hi, I'm Dr. Baptiste. I'm a general practitioner or family medicine doctor based in the UK. In this video, I'll be talking you through the main licensed treatments for migraines. In an earlier video, I briefly discussed the rarer types of migraine, so you may want to give it a watch by clicking on the card above. Quick note that this video is not a substitute for sound medical advice. If you have any concerns or experience any symptoms at all, please do visit your general practitioner for more advice. This video will be divided into two parts, acute and preventative treatments for migraine. Let's begin by looking at acute migraine treatments in adults. When someone experiences a migraine or has an episode, we want to stop or terminate that attack. At the very least, we want to reduce the severity of the pain that they are experiencing and any other related symptoms they may be suffering from too at the time. The pain from a migraine attack can be very intense and debilitating, in some cases stopping the person from carrying on with their usual activities, such as work, cooking, or their hobbies. There are four main treatment options traditionally used. There is a newer option that has been recommended this year, which we will discuss too. 1. Non-steroidal anti-inflammatory medicines, or NSAIDs. Examples are ibuprofen at a slightly higher dose, such as 400 or 600 milligrams. Aspirin again at a higher dose, 900 milligrams, than you'd use in other medical conditions, such as for heart disease or some types of stroke. 2. Paracetamol, 1000 milligrams. 3. A medication called atriptan, which is a type of medication that temporarily narrows the blood vessels in the brain. There are different types, and you may have heard of sumatriptan. This is the triptan that is commonly prescribed because it has been shown to be the safest and the most effective in comparison to the other ones. Triptans can be used with an NSAID or paracetamol. They can be taken via mouth, nose, or just beneath the skin. These treatments are taken as one single dose as soon as the symptoms are experienced. This is a really important point in treatment. Sumatriptan should be taken as one dose and then repeated 2 hours later if the symptoms have returned. There is a newer medication that can now also help, which has been approved for use on the NHS. Vydura would be prescribed if 1. You have tried at least 2 types of triptans, but they haven't worked for you. 2. You can't take triptans, or you are unable to tolerate them, perhaps due to significant side effects. 3. NSAIDs such as ibuprofen or aspirin and paracetamol were not very effective for you. Now, let's look at how we can prevent migraines. In order to prevent someone, perhaps like yourself, suffering from migraines, we can prescribe several different treatments. We will look at these shortly. Preventative treatment helps specifically to try and reduce the amount of times you may suffer with migraines, how severe they are, and how long they last. There is a condition called medication overuse headache, which in essence is when the medication that you are taking, usually for your acute attacks, becomes overused, which actually causes you to have a headache or migraine. So preventative medicine helps to stop you suffering from this condition. There are specific criteria for starting preventative treatments. However, how your migraines are affecting your quality of life should be considered. As health professionals, we should be taking into account what treatments you might want to consider, any other medications that you're taking, and other medical conditions. Overall, you might want to consider preventative treatment and discuss this with your healthcare provider if your migraines are 1. Significantly affecting your quality of life. For example, you're unable to partake in activities that you enjoyed, or you're unable to spend time with your family due to the migraines, as examples. 2. Occurring more often, such as more than once a week. 3. Still quite severe even when taking the acute treatments we have looked at. Also, if you can't take the acute medicines because of a certain medical condition, or they simply have not worked for you, then preventative treatment might be an option. You might be at risk from developing medication overuse headache, as you're having to rely on the acute treatments more and more often. When starting a new treatment, we generally start on a low dose and increase in a stepwise manner, reviewing how you are responding or not responding to the treatment and any potential side effects that you may experience. Finally, in a previous video, I discussed rare types of migraines, and in these cases, you should even see or have your case discussed with a specialist before starting on these types of medications. So what types of treatments might you be prescribed as a patient? Propranolol. So this is a medication in a group of medications called beta blockers. It can be used to treat heart conditions and anxiety too. Topiramate. This is what we call an anti-epileptic medication or a medication to treat epilepsy or patients who suffer with seizures. Amitriptyline. This is a medication called a tricyclic antidepressant, but commonly in the UK, it is used to treat a specific type of pain. Botox. This is a type of toxin that can paralyze muscles. You may associate it or have heard of it more commonly used in aesthetic or cosmetic procedures. However, it can be used to treat a variety of other conditions, such as back pain and stroke. It can be prescribed if you experience migraines chronically, so on at least 15 days per month. Bear in mind that you would have had to have tried 3 preventative treatments which have not worked for you and have been treated successfully for medication overuse headache. So you would probably have been referred to a specialist by your GP who can give you this medication. Botox is given by injection just under your skin or into the muscles in your head and neck. How long can it take to see an effect? Key point to be aware of is that it can take roughly 4 to 8 weeks from starting your treatment for you to notice an improvement in your symptoms and migraine attacks. It is really crucial to stay in touch with your healthcare provider, to have regular follow-ups discussing how your symptoms are progressing and any side effects you could be experiencing from your medication. What are the other non-medical or drug-based treatments that you could try? These treatments could be used at the same time or in place of the medications that we have looked at. Examples of such treatments include 1. Mindfulness or meditation to help you relax. 2. CBT, cognitive behavioral therapy. This helps change the way you think and therefore react to situations. 3. Acupuncture. This can be used if propranolol and topiramate are not suitable or have not worked for you. 4. Riboflavin, one of the B vitamins. But you should not take this if you are trying for a baby or currently pregnant. So that is a brief summary of some of the key treatments we use for migraines in the UK. If you do experience new worsening symptoms or have any concerns at all, please do get in contact as soon as possible with your GP. You can also call 111 and in an emergency 999. Please share and like the video if you found it useful. Feel free to subscribe if you want to learn more about health-related topics.